Genetic testing's been thrown around a lot lately. A lot of people are doing it, and it's something that I think can be a useful tool. However, there's also sometimes people will come to me and they're like, do you do the genetic testing? I'm like, yeah, I'm happy to do the genetic testing for helping people see, what medications and how like they metabolize them. But I also give them a fair warning that, these kind of medication genetic testing, that's done, like, it's not going to say which medication works best for you. There's some claims, like people will claim, like, I'm going to give you this genetic testing. It's going to tell me exactly the meds that are going to be the best choices for you and how well they work. We just don't have that science yet. The genetic testing can tell us a little bit about how you metabolize the medicine. Maybe you're a super fast metabolizer. Liver is chewing up the medicine and you may need a lot higher doses versus someone that's liver is like not really eating the medicine up and it's kind of lingering around, and you may need lower doses or else you're going to have more side effects. It can tell us stuff like that. However, there are some studies that show that some of these genetic testing is kind of iffy on even how well that stuff translates to reality. But for people that have a bunch of things they've tried, I will order that testing for them. Or even if they come to me and they haven't been on a ton of stuff, but they would like to, know a little bit more about their body, I'm happy to order those tests for them for those reasons too, to give some more information. The studies compared someone that had the testing versus someone else who didn't. They did some controlled trials on it that, there wasn't much difference in outcomes. So it's more of a information kind of tool, but how much it translates to the end product of what we end up using is variable. But that is something that I run into a lot, is that people are being told, oh, I have this amazing tool that will tell you exactly which medicine works for you, when that doesn't exist. So if people tell you that, just kind of question it. There isn't a magic ball that will tell you that at this point, but we can, fingers crossed, hope that will be a thing in the future.
It sounds a little bit like a scam.
I think so. I do think so. There is a lot of scamminess to it. And it was interesting because some of these genetic testing places, they also showed that if you sent it to one lab versus another lab versus another lab, you would end up with 3 totally different results when you got the answers back. That how reliable are these tests is suspicious. I use one that's had a little more research than others. However, I still take it with a grain of salt. This is not the end all be all, and that we still need to use the tools that we have that we know are useful, such as me taking a really good history, really understanding your symptoms and how you interact with medications, and using that as an additional tool, but not as something you should base a treatment choice alone.
Sounds like a great project to do. Just with yourself, apply to all of them, make a video about, okay, this is how I would treat this person if I only had this information, the same person in different areas, according to the results, see what happens then.
Yeah. They sort of have done that. There have been some full controlled trials that did that. Basically, the results of that was that there wasn't, that you would get a bunch of different results, and then was one of them like the better option when you treated them as such with this program, or this program. The results mostly just showed that the results were just as good as if you didn't have any testing at all. So I don't ask patients to spend $200, $300 on testing, although there are a lot of places you go to, and that is one of the first line things they recommend. Here, get this expensive testing done. I'm only will mention that if I think, okay, this is someone that we really might see something on it, such as your metabolism of a medication is going to be really unique or different in a way that would serve us in picking which medication is going to be useful for you.